From Korea. Actually, I started this the hair growth business 12 years ago. When you started, actually in Korea, few doctors do that treatment. So we start to set up the protocol and learn from the doctor. Actually, we do something with doctors, and then we develop our system. So today I will share with you of our experience and know-how while we are struggling in the hair loss market. And I have only 30 minutes, so I have 200 slides, so I cannot present all. So I will show you the video clip, very short video clip. Through this, maybe you can understand the simple concept, the very simple concept of how we treat the patient. The difficulty to handle with the alopecia patient is that it takes long time. The skin thing, using laser, maybe only one session, you can show the differences before and after, right? But for this, it takes time to grow. So at least 3 months to 6 months, you need to prove the efficacy to your patient. So in this case, not only just prescribe or do some procedure, you have to educate the patient, make them understand the long procedure, why, the reason, everything. So I will show you what Korean doctors did. Actually, there are so many types of alopecia, and we can group that into male patternal loss and female patternal loss. Most of them are male and female, and then some persons suffer from the alopecia areata. The male patternal loss, actually, ordinary people can diagnose what it is, right? You see, and then you can notify that that is a baldness. But for female, a little bit difficult, because female has, as you see, no clear-cut boundary. It's kind of a diffuse type, so it is difficult to notice when it starts. Anyhow, the woman and man have a different reason, different cause. In the market, most of the products they promote for men and for women, for alopecia areata, both. Only one shampoo and solution, one ampoule, everybody can use, but our system is different because the reason is different. For example, male patternal loss, there are many reasons, but DHT is a main factor. So we use the finasteride to block the DHT. And women's, actually, there are no clear-cut major reasons. There is kind of a complex reasons. And basically, you have the oral taking drug finasteride, and you have a topical minoxidil. That is a basic treatment, but the problem is using the drug only, it takes long time. So usually patients drop out before they notice the efficacy. So what Korean doctors did is that they use all the weapons they can use to make the effectiveness shown faster. Basically the scalp care thing, maybe there are so many scalp care center, health center, they do the same, but we provide something different, focusing on disease on your scalp. And the mesotherapy, we found that mesotherapy is the most efficacious and the fastest way to promote the hair growth. And later, I'll show some clinical data presented in ISHRS and basic medication. But most men are afraid of the side effect of the finasteride. Actually, it is a little bit exaggerated, but still on the internet there are so many kind of a sexual dysfunction phobia or something, so they wouldn't take it. So we need sometimes alternatives. And daily care. Sometimes some shampoo they use provoke some kind of irritation on scalp and some problem. So we give them the mild shampoo and some solution containing the nutrition component. And all the products actually are divided into male paternalis, female paternalis, hair loss. The application is same, but the active ingredient we use is different. The once a week scalp care and daily shampoo and solution, and daily the oral taking, and usually once a week mesotherapy. That is a kind of a standard in Korea. And also, you can use some the hair loss treatment equipment. It is make the efficacy faster, and then patient wants something different, like laser in the skin. To save the time, I skip the later part. I think that most of you are specialized in the skin things. Not many for the hair loss treatment. 10 years ago, the Korea, the environment is similar. So I'd like to, what can I say, good things for the hair loss treatment. This is what our system is. I'll explain later. Okay. Actually, most of the doctors in 10 years in Korea, they think the skincare is profitable and alopecia is not. But the problem is that skin thing is kind of a red ocean. Many competitors, so maybe price war. But the alopecia area is new market. And one more thing is that for the skin, laser or medical equipment, doctor, you yourself should do that. It means the higher labor cost. But for hair loss treatment, usually in Korea, the staff, you can make your staff do most of the procedure. You can, the doctors only do the mesotherapy. 5 minutes mesotherapy is enough. So it means very low labor cost. And also you don't need much investment into the very expensive laser things, right? You have to buy always, every year you have to buy expensive the machine for skin, but this hair loss area, not. So less investment, you can start. Okay. I'll skip. This is kind of this is example of Japan. Actually, Japan is a little bit more advanced than Korea in many aspects, especially in economic everything. But in Japan, I don't know why, but doctors do not care about the hair loss treatment. So the hair salon and then the spa and the scalp care center, they occupy most of all the hair loss treatment market. People just think that they should go there, not for the clinic. So, but on the contrary, Korea, before 10 years ago, doctors started to do the hair loss treatment seriously. So now, most part of the market doctor is share and growing. So what we did, I'll show you something. This is a clinic. After they introduced the hair loss treatment, the clinic sales increased. For example, 5 times. This is almost twice, 4 times. So yeah, it's a very good way to make your clinic profitable. So you just add the alopecia treatment together with your staff. Okay. As you know, there are basic solution, the finasteride and minoxidil, and it is the efficacy explanation. So as you see, people notice the efficacy very late. Usually 9 months, they notice the new hair growing very late. But the problem is the patient is not that patient to wait for many months without efficacy. So Korean doctors try every option to show the faster effect. So they did everything, the medicine and equipment and mesotherapy and scalp disease care and self-treatment. So altogether, it really ensured the faster effect. I'll show you what. So maybe this is before. Maybe if you make this to this, if you just prescribe the drug only, maybe it'll take around 9 months or 1 year, right? But this is only 3-month result using everything. So 3 times faster. The patient really satisfied with this faster effect. But this is only one picture. So actually, as a developer, I myself questioned, doubted, is it really that fast? So I did some kind of a very simple survey. So I gathered some data from every clinic. So I gathered 100 data, and then it shows really faster effect. So around 4 weeks, they start to see the decreased number of the hair loss, and around 1 month, they feel the strength of the hair and the thickening of the hair. The hair loss patient is very sensitive, and they notice very sensitive the subtle changes. So they report like this, and within 2 months, they started to report that they observed the new vellus hair coming out. So very fast. Comparing to the drug only, as you see, this is the same, almost same explanation, and then 3 months, the 1 month, new hair coming out, and then 6 months and 2 months. So usually 3 times faster. This is the scalp condition. Actually, the scalp condition is not directly related to the genetic, the hair loss, but ordinary people believe to make the healthier hair, first they should make the healthier scalp first. Why? The scalp care center and hair salon promote like that. And then people easily believe that to make a good plant, we have to make the earth is earth is good first, right? So they thought like that. Anyhow, so it is very good to make the scalp condition improve to convince the patient to trust you the treatment. This is some surveillance result. In 3 months, when you do every option, most of the patients satisfy the changes. Okay. As you see, this is a male pattern loss, and the reason mainly known to the DHT, and so finasteride block this process, so it inhibits the 5-alpha reductase. So in our product, even though it is not a drug, we've searched some component which have a similar mechanism of action. So, for example, azelaic acid, zinc, and friction HCl, they all come together in a very low concentration, inhibit the 5-alpha reductase. Published in British Journal of Dermatology. And sulfalmitol, also known for the sub-treatment supplement for the prostatic problem, but the mechanism is similar, the DHT problem, so we start to apply this into the hair loss treatment. As you see, most of the active ingredient is a natural and herbal extract. And this copper iron also have this kind of data. And maybe some of you are familiar with the copper peptide, because that active ingredient is actively used to the skin regeneration as well. But according to the textbook, it said the copper peptide is effective in hair loss treatment and post-hair transplant maintenance as well. So we use a lot. Many companies use this, but it's very strong regenerating the power. But the problem is the concentration. Actually, this is not only applied to the hair loss treatment. Maybe you use lots of the cosmetic products. Cosmetic products do not regulate it by the concentration or the amount. The drug should be, right? So you have to always check what's the proper concentrate. So actually we use 1,000 ppm, but usually the developers use 10 ppm or something. So you have to check. Okay. But when I developed some product more than 10 years ago, I didn't realize that the reason is different. But I heard from the doctor, your product is quite good, but only for men. For women, 1 or 2 out of 10 women do not have an effect. So I have a question why. So I searched some papers, and there are so many papers. It says that male pattern loss and female pattern loss is different, and also the study result is the same. But mostly in 3 months, male pattern loss improved. Most of the male pattern loss improved, but female pattern loss 20% is no effect. So there are many papers telling the differences. So we need a different active ingredient, different solution for men and women. So we developed all divided, the product. This is typical women's type. This is just the scheme, not well known, but anyhow, male paternals, the cause is mainly DHT, but female, many things. Actually, I think that's not clearly known yet. So in this case, we have to put more regenerating agent for women. For men, we try to use the DHT blockers. For example, female paternellus, we use the phytoestrogen. And some glycogen complex, it has a data to grow faster. And it will ensure the more Berber cell myotic activities, so more kind of workers to make a healthier hair. And also, as you know, the ECM also have a important part in the hair loss. Do you have a very healthier ECM, then it will ensure your health of the hair, but it's not, then vice versa. So this is, for example, this is young skin, and this is have a problem with the rigid collagen. So in this case, we can notice that aged skin and young skin. The same in the hair. Occipital zone, usually the hair you have, like this, the very good, the collagen, ECM, and frontal zone, if you have alopecia, there is some problem with the collagen. Yeah. So it is helpful to making sure to generate the healthier collagen or ECM on your scalp. But some cases, the women's, I heard from the doctor that maybe 10% of the women have not typical the female type. It's kind of a mixed type of the male and female, and vice versa. Some part of the male have not the baldness, the clear-cut baldness, but they have the low dense of the hair, similar to female. And there is alopecia areata, but the patient, the number of patients is not that many, so today I'll just focusing on the female and male paternellus. Okay. For this alopecia areata, the known reason is the immune privilege collapse, right? So our product help the immune privilege restore. So we used IGF and TGF beta related the component. Okay. Regarding the component, active ingredient, I'll just skip. If you are interested in it, later you'll have some kind of information and data. You can see and you can just understand, I think. And help plantation, I will also skip. Okay. The one thing I can tell you that after hair transplantation, patients feel very anxious. So if you give them a special, if you do not give them a special product, they think that something's wrong. So in Korea, we provide them the special shampoo and special solution to suppress the irritation and the inflammation, and also to ensure the survival rate. And we provide something special the spray shampoo, because after hair transplantation, they are afraid of the rubbing, right? So we just provide the spray type, just spray it and then wash it out. That's okay. So it is very convenient for the hair loss, hair transplantation patient. So as a whole, our product line is all divided according to the cause. Man, male, and as I said before, we have alopecia areata product. It will usually, for the alopecia areata patient, you should do some immunosuppressant therapy, and then if you add this, the study results show that a month, the faster to regrowth. And this is the hair loss treatment care product. And then it also ensures that after hair transplantation, most of the patients cannot do the normal daily life because they have the blood scalp on it, so it looks so ugly. But using our product, it prevents the generation of the blood scalp, so they can return to their normal life within 1 or 2 days. And one more thing is that seborrheic dermatitis. Actually, I don't know why is it, but we 10 years ago we did some kind of a surveillance. The prevalence of the seborrheic dermatitis symptom among hair loss patients. Usually, the seborrheic dermatitis, the prevalence is around 3 to 5% in normal population, but among the hair loss patient, it is much higher. So I don't know why it is so abnormally higher, but now I have some ideas that the hair loss patient change a lot of the shampoo, and they usually like strong shampoo. They change stronger shampoo. So it provokes some kind of the irritation on your scalp. So mostly this symptom, I think, provoked by the component of the shampoo. It's kind of a not seborrheic dermatitis. It's kind of a irritant, the dermatitis, I guess. But anyhow, they have this kind of symptom. So if you solve this symptom, they will start to believe your ability to improve something, and then they will start to believe your ability to make hair growth. It is very fast. 1 week, make it half symptom relief. And this is usually, so it's very fast and very safe for the daily use. And major therapy you already know, and then one thing I can tell you that do not do nappage. Nappage is always loss of all the active ingredient. If you ensure do something, some active ingredient inside, for example, PPP or papule you do, then you can ensure the efficacy. 10 years ago, many Korean doctors do the nappage. So I found that most of the active ingredients just there and evaporate, do not go inside your scalp or skin. No effect. So only one thing, you have to ensure that to penetrate the active ingredient. Then it is very simple way, right? Topical product, the problem is the absorption rate. Everybody knows, but this absorption rate theoretically 100%, so it will be very powerful way. So this effect is mainly major therapy. Why? During 3 months, usually drug cannot show this kind of effect. This faster effect usually from the major therapy. And this is an interesting case. This person already take oral finasteride and minoxidil for 1 year, so have some kind of effect on the top part, but this part, no effect. So he transferred to another clinic, and then the doctors actually happened to be our client, and he did something more, the mesotherapy, and then as you see, the beginning, the no hair, but only 8 weeks, it start to, you can detect some hair, right, growing. So mesotherapy is very good way for this. Actually, the result was presented in ISHRS before. Actually, this person visited some clinic for the hair transplantation, but the doctors explained the hair transplantation is once or twice chance for lifetime, so reserve it and then first try the treatment. If you are not satisfied, then I'll give you some hair transplantation, blah, blah. And then this is a result of the within 6 months. So very dramatic. They don't need to get the hair transplantation at that time. Maybe they will save that for the late. It has a very good the data. Diameter and density all increased. This resulted only 10 treatment once a week, so a 10 weeks result, very dramatic. Okay. When I show that data to other Korean doctors, most of the doctors do not believe it is too dramatic. But the difference was, actually I learned from this doctor. She did like this point by point, exactly try to input the active ingredient, while other doctors do the nappage, so no effect. So only that, very simple technique, you can ensure the faster effect. Okay, I'll skip the ingredient. I'll skip. Okay, and one more thing I'd like to recommend is that you have to diagnose properly. So we provide some diagnostic camera which is auto-diagnose. So if you do or your staff do, always the same diagnose, because we use the image processing technology and pattern analysis. So when you take a photo, we provide this guide. So every time you do, you can take the same position, same distance, same angle. With other ordinary camera, always different angle, different the position, so you cannot properly compare later. But ours provide this, so you can compare later. And one more thing is that something like that. This is a Savin scale, and this is a 4-time magnified the diameter and density check. Once you get that those pictures from your patient, this will automatically diagnose. And 1 month later, 6 months later, automatically diagnose. So you will have exact the improvement data and to show to your patient. And also using this, you can compare, you can call the other guys, previously the treated guys, the database, and then compare and then show to your newcomer. Then he or she can expect his or her future through the other person's database. And you can show like this. As a result, you can show this kind of slideshow to your patient, because we will take a exact same position, same shape. Only the hair is more growing, so like this. Okay. Oh, 4 minutes, yeah, passed. Okay, this is my presentation. I finished. Thank you for listening. Okay.